Do you find yourself using any activity or any substance more often than you'd like? Or have you noticed that you need to use more to some activity or some substance maybe to feel the same way? Or is any activity or substance causing any problem at home or in your work or in your relationship? Do you feel like it's harder to manage things because of some kind of your activity or substance use? Have you ever tried to cut back or stop but found it difficult managing without some activity or some kind of substance? Do you feel like it's hard to go without some kind of activity or substance for a day or for two? Do you feel anxious or upset if you can't use some kind of substance or activity? Have you noticed any changes in how you feel physically or emotionally when you don't use it? So, if most of your answers are yes, then you might have some kind of addiction. Then this video is for you. This session is for you. You are at the right place. Hello, everybody. This is Dr. Farzana Begum. I'm an academician, researcher, author, reviewer, speaker, and health and wellness coach. You can access some of my works on these sites I have mentioned here. So today here we will discuss about what is addiction, what are the cardinal signs of addiction, what are the various types of addiction, what are the causes of addiction, what is the physiology of addiction, how to assess for addiction, what are the strategic management for addiction, and at the end we will conclude. So these are the points we will discuss now. So what is addiction now? There are certain activities we are doing in our daily basis. These are called habits. And some habit they are a regular behavior practice and they are beneficial for us also. For example, going to bed in a fixed time, waking up in a fixed time, or having your meals in a fixed time, doing 30 minutes exercise every day. So there are so many behavior, those are regular, and we are doing, practicing in a regular basis. Every day we are doing. Those are called habit. And if we don't practice those things, we feel uncomfortable. If, for example, you are doing every day 30 minutes exercise and for any reason you are busy or something, someday you are unable to perform that 30 minutes exercise, automatically you will feel uneasiness, discomfort. It's like your day is incomplete, you will not feel good. So this is called habit. That means when some activity we are doing in a regular basis is impacting our brain also, our mind also. So our mind accordingly accepted and habituated with those kinds of behavior. But there are certain habits those are not beneficial for us. And when these habits they are very much intensified, then that transform into addiction. Addiction is a chronic condition that is characterized by a strong physical, psychological compulsion to engage in a particular activity or consume some kind of substance despite knowing its negative consequences. The shift from habit to addiction can be gradual and happen unconsciously. Now, what is addiction? According to Mark Griffith, there are six core components of addiction, such as salience, mood modification, tolerance, withdrawal, conflict, and relapse. Any behavior that features all the six core components is addiction. Salience refers to any particular activity that becomes most important in one's life in a way that dominates his or her thoughts, feelings, and behavior. The person is preoccupied with the thought even when not engaging in that activity. Then next is mood modification. Mood modification, it is a subjective experience of an individual after getting engaged in that particular activity. Tolerance is a consistently increased need for the particular activity or substance to make the individual feel the same level of pleasure as earlier. Withdrawal, it is the consequences that occur when the particular activity is suddenly reduced or discontinued, that may be physical or psychosocial. Then conflict, when the addicted person, they may suffer from interpersonal or intrapersonal conflict, which usually compromises their personal relationships, work, education, and society and recreational activities. The interpersonal conflicts usually involve feelings of guilt, hopelessness, these things. Then relapse. Relapse, it is the repeated return of earlier pattern of the particular activity. So these are the six core means what you can say. These are the six core components according to Mark Griffith. So if someone experiencing all these six components or they feel these things are happening with them, then that person might be addicted to something. Now let us see what are the cardinal signs of addiction. Cardinal signs means typical specific signs of addiction. So first one is obsession. Obsession means the preoccupation or the thinking about something all the time. That is called obsession. Second one is lack of control. Lack of control is trying to control the behavior but unable to do so, and difficulty in stopping the behavior, continuing the behavior despite knowing it poses significant risk to health or well-being. Now, negative consequences, these are issues associated with the behavior like grief, financial distress, career loss, relationship problem, deterioration of physical and mental health, physical dependency, experiencing withdrawal symptom when the substance or the activity is discontinued, social problems like strained relationship or difficulties at work, school, home. Then denial. Denial, the person is not ready to accept the truth. Rather, honestly, they believe that they are right. They don't have any problem. Now, what are the various types of addiction? All the types of addiction can be categorized under two major headings such as substance and non-substance addiction as per DSM-5. Now what is DSM-5? DSM-5 or also known as Diagnostic and Statistical Manual for Mental Disorder, 5th edition. It is a comprehensive manual that published by the American Psychiatric Association that provides standardized criteria for the diagnosis and classification of mental disorders. Substance addiction means like if someone is addicted to alcohol, some kind of drugs, those things are. Non-substance addiction like gambling, using too much of internet, shopping, social media, gaming, these are the non-substance addiction. Now let us see what are the underlying causes of addiction. The underlying causes, we can again divide them into two categories. One is internal factors. These are the personal traits or characteristics that come from within the individual, such as personality, genetic factor, family history, etc. Personality means some people may have traits like impulsiveness or difficulty coping with emotions, making them more vulnerable for addiction. Genetic factor in a family, if they have history of addiction, that can increase the risk, and as genetics play a important role in how people respond to substances or behavior. Then family history, growing up in a family where addiction is present can influence behavior and coping mechanism. Then external factors, these are the factors that influence from the person's surrounding or life circumstances, such as environment. Living in a place where addictive substance or activities are common, easily available, increase the exposure and risk. This is one cause. Then peer pressure, the influence of friends or social groups can lead to experimenting with substances or addictive behavior. Stress, another factor. High level of stress, whether from work or maybe related to relationship or any life challenges, anything, stress due to anything can drive individuals to seek relief through addictive means. Easy access, when addictive substances or any activities are readily available, the chances of misuse are higher. Then addiction and escapism. People often, they are not actually addicted to some substance or behavior itself. They are addicted to the way it helps them to escape from their reality. Addiction can be a way of numbing emotional pain, avoiding problem, or temporarily feeling in control. So recognizing the underlying need for escape is crucial in addressing the overcoming addiction. So actually what may be the underlying cause, but the main factor is that people often a time they addict to something to escape from their real life situations, stresses, okay, or the things they want to avoid. Now let us see the physiology of addiction. What happened if someone is addicted? So in case of addiction, the limbic system of the brain that plays a very important role, vital role. The limbic system is a set of brain structure that is located at the border of the cortex. The primary structure within the limbic system include the amygdala, hippocampus, thalamus, hypothalamus, basal ganglia, cingulated gyrus, ventral tegmented area, nucleus accumbens, and prefrontal cortex. There is a neurotransmitter in the brain called dopamine, which is responsible for functions like reward, motivation, pleasure, compulsion, preservation, perseverations, and decision making. It releases in various pathways or channel and leads to different functions in the body. When the dopamine they release in different channel, so as per the channel they uh, means they leads to different function in the body. In case of addiction, it follows the mesolimbic pathway, that is also known as the reward pathway or the reward system. This pathway is starting from VTA ventral tegmental area to the nucleus accumbens. The release of the dopamine through the mesolimbic pathway into the nucleus accumbens regulates the incentive, for example, the pleasure, motivation, and desire, etc., to rewarding stimuli and facilitate reward related learning. There is another neurotransmitter in the brain called serotonin, which is responsible for functions like mood, memory processing, cognition, emotion, aggression, sleep, appetite, anxiety, memory, and perception. The impaired regulation of the mesolimbic pathway and serotonin pathway, they play a significant role in the development of addiction. Now here in this picture you can see any kind of stimuli that may be natural, that may be artificial. Natural like sex, food, water; artificial like alcohol, gambling, drugs. So any kind of stimuli, they stimulates the mesolimbic or the reward pathway first, and then they leads to dopamine production from the VTA, from the ventral tegmental area. Now this dopamine then stimulate the nucleus accumbens and prefrontal cortex to produce the highly pleasurable sensation, which further increase the desire for the stimuli for further getting the same level of pleasure, means as they experienced before. So this is referred as tolerance, and the increased level of dopamine in the cerebral nervous system that decreases the serotonin production, which hampers the mood, memory processing, cognition, emotion, aggression, sleep, appetite, anxiety, memory, and perception, everything. And this is called addiction. The brain is composed of many different regions and structures which form the brain's communication system. Each of these different region or structure, they serves for different purpose and coordinate various activities. Any kind of addiction, they can alter the function of these regions. For here you can see the regions like parietal lobe. It is mainly responsible for knowing the right from left, sensory discrimination, body orientation. The occipital lobe mainly responsible for vision. So if someone is addicted, and that addiction, that activity, or those substance that impacting the CNS, nervous system, so these areas, the functions of this area, they impaired. That means it will impacting the vision, impacting the thinking process, impacting the gait, memory, speaking, everything will be impacted. Now let us see how to assess for addiction. So to assess addiction, What are the things we need? How we can assess? Remember, an addiction assessment, it is a way to understand how a person is affected by a particular substance or a activity or behavior to see if they might have an addiction. And it looks at three main areas: history, physical assessment, psychological and behavioral assessment. History means inquiring about the person's past history, current use of substance, past history of use of substance, use of substance in the family, so related to addiction. So history involves collecting information in all these area or inquiring in all these area. Also, whether there is any problem existing related to the behavior or use of substance or activity, any medical history, family history, any issues or any physical or psychological issues experiencing because of the use of certain substance or activity. Then physical checkup. This is to look at the person's overall health to find any physical effects or of addiction, like withdrawal symptom, health problem caused by substance or behavior. Then psychological behavioral assessment. This is to understand how the addiction affects the person's thoughts and actions, including how it impacts their daily life, relationship, and emotional well-being. Now let us see what are the strategic management to deal with addiction. The first rule of recovery is to develop insight. Recovery starts with understanding and accepting the problem. Without insight, recovery is not possible. Over 80% of people, they don't seek help because they don't realize that they are having a problem. So the person who is struggling with addiction must take responsibility for their action. Without their willingness and cooperation, it's not possible for any individual to recover from the addiction. Recovery is not possible without the cooperation, without taking the ownership. Okay, so the person must be ready to take the ownership and ready to cooperate in the recovery process. Second one is be honest. Honesty is the key to recovery. You need to be truthful with yourself, your therapist, your family member, those are supporting you in the recovery process. Lying creates a more creates more problem, and it reopens for addiction. It increases the risk of relapse. The third one is learn to relax. Relaxation helps managing stress, which often triggers the addiction. Simple activities like walking or structured practices like meditation can help a lot. Daily relaxation, especially through meditation, is very important for staying calm and avoiding addictive behavior or addictive urges. The next is coping skill. Learning how to relax, manage stress, and change negative thinking is essential. When stressed, people often fall back into bad habits. So that's why coping skill is very important. Learn how to cope with the stress. Cognitive behavior therapy. This therapy helps identify and change the negative thoughts and behavior. It teaches healthier ways to cope with triggers and stress. Now next is this family therapy. Addiction affects not only a single individual, it means impacting the whole family. The whole family, they get disturbed when any one family member, they become addicted. So family therapy helps improve communication, set healthy boundaries, create a supportive environment where it promote to means less using the addictive substances. Our family plays a very important role in keeping the person staying away from the addictive behavior or addictive substance. Now next is interpersonal therapy. Interpersonal therapy that focuses on social relationship and skills. It helps addresses loneliness, improve communication, and build meaningful connections to give life a purpose. Next is group therapy. Group therapy brings people together who are facing the similar problem, similar struggle. It provides a safe space to share experience, get encouragement, and learn from each other. It reduces the feelings of isolation and builds a sense of belonging. Next is motivational interviewing. Motivational interviewing helps people discover their own reason to quit addictive behavior. It empowers them to make positive changes based on their personal motivations. And then the last one is drug treatment. In severe cases, there are medications that might be needed to manage the craving or withdrawal symptom. Drug treatments are often part of a larger rehabilitation program. These steps, along with consistent effort and support, can help someone recover and build a healthier life. So, there are in certain places, there are boot camps are there or the de-addiction centers are there. What they are doing actually in the de-addiction center, they are having some group session where all the means those are having the same problem, they discuss their problem, they discuss the underlying causes, then how they feel, how their addictive behavior impacted their life, their work, their social life, relation, everything, how means became worsen, how they means everything lost. So they discuss all these things and then they support each other. And when they are in a journey of recovery or in the de-addiction center, every day or in every session they discuss their progress. So how they're progressing and how they're feeling, how it was before and how now they are feeling, they discuss all these things. So these are giving them motivation to keep in the track in the recovery process. Then there are schedule, everyday schedules are there, so they follow the schedule. They means go to bed timely, they wake up in particular time, they are going for meditation, other exercise in the de-addiction center itself. So this is how gradually they recover from the addiction and they can join their pre-morbid stage again. But this needs patience, understanding, cooperation, willingness, support, and very important is truthful. So now we reached at the end. So what we understood, what we discussed or learned from this session, that uh, again you can imagine, have you ever thought about speaking to someone who can help with this? So people often time those are addicted, they don't understand that they really need support and they don't know whom to speak. Okay, so this is very important. We need to increase the awareness among the people in the society, in the community, that these are the real problem, and there you can always speak. There are person whom you can speak and get support, like the psychologist, or you can go to any de-addiction center. You can discuss with your family members if you really need to overcome the situation, or you really want to recover from the addiction. You need to talk. So you should accept that you have a problem and you need to talk. This is primarily very important. Then addiction, it is a treatable condition, remember that, and it happens because of a multiple factors, including change in the brain, genetic, environment, personal experience. So recovery begins with a willingness to embrace the positive change. Being completely honest to yourself, others, are the key part of the process. Anti-craving medications can help manage the early stage of recovery, but long-term recovery is about more than medicine, and it requires creating a new way of living, a new life that makes it easier to avoid the addictive substance or behavior. So learn to manage stress effectively, practice relaxation technique like deep breathing, meditation, physical activity to stay calm and focused. So remember, recovery, it's a journey. Recovery does not happen overnight. It's a step by step process. And celebrate every small victories, stay honest, focus on building life that supports well-being with courage, with resilience, with support from others, and a lasting change is always possible. Each step forward brings you closer to a healthier and more fulfilling life. So here the references, the sources are mentioned in this slide. Here also mentioned the sources and the license information of the pictures. Those are used in the slides. So thank you very much for joining me, and you are always welcome. If you need any support from me, you can contact me.